Now let's talk about lesson 3, which is the effect of aging on sensory function. And as you know, sensory function is one of the very functions in the body of an older adult because it is often, as we said, it's often taken for granted that older adults are going to have a reduction in their sensory function, for example, in their hearing and especially in their vision. However, this is one of the myths that we really need to follow up with sensory function and to protect sensory function from harm and to keep them intact for as long as we can so we can have a better quality of life for older adults. I would like you to read chapter number 26, which is on sensory deficits. Okay. So let's talk about vision. So there is a reduction of elasticity of the lens around the lens. So there is a decrease of ability to focus, or what we call a presbyopia. Presbyopia is very important to know, and I would like you to read more about it from the book. So there is also a visual acuity decline. There is a light perception threshold decreases, so they are unable to see from far away, and also the threshold of the light may decrease, so they are unable to see in darkness. Okay, so dark and light adaptation takes longer. So when they go from dark places to light places, it takes them time or longer time than younger adults. Okay, there is an increase in sensitivity to glare. Okay, so they cannot see a lot of glare or like reflections from the mirror, for example, or glass. There is also a distortion in the depth of perception. So, for example, if you can see something from far away, they see it in a hazy way. There is a decrease in the depth of perception in general. Okay, so let's talk about hearing also. So there is what we call presbycusis, which is a sensorineural hearing loss, which is related to aging. The second problem is impacted cerumen, and impacted cerumen is the most common problem that we can face in older adults. Okay, so how do we promote sensory function? First, we need to promote vision. So routine eye examinations that are very thorough and very detailed are very important. So how regularly? Every 3 to 6 months or at least yearly. So if they are diabetic patient, at least every 6 months. If they are non-diabetic or they are not hypertensive patients, then we don't need to do it regularly. We need to do it, as frequent, but we need to do it yearly. Early detection and treatment of problems is very important, and that's why we need to do thorough physical examination. There is a huge consideration of financial ability to receive treatment, especially those who need an eyeglass. We need to consider what type of eyeglasses because they may be very expensive, such as, for example, I heard some of the older adults saying that it may cost them at least 90 to 100 reals. So it's very important to consider financial ability. Okay, prompt evaluation of symptoms. So if there is any symptoms, like if they mentioned something, let's say I see everything cloudy, I see half of the picture, I don't see from far away, these are symptoms that should be evaluated promptly, because some of this sensory dysfunction or this sensory loss can be treated early at an early stage versus at late stages. There are other considerations like atherosclerosis, hypertension, diabetes, and nutritional deficiencies that can threaten our older adult vision. So, for example, for causing cataract and causing glaucoma, and which we'll be talking about them later, and then also causing some vascular destructions in the retina and degenerations, of course. Book that I would like you. Let's talk about glaucoma. Glaucoma is the second most common thing, and there is a damage to the optic nerve from an increase in an intraocular pressure, which can be caused by diabetes mellitus or hypertension. It is the second leading cause of blindness in older adults, so it's very important to treat glaucoma very early. Okay, and compliance with treatment regimen for glaucoma can be a challenge for older adults because they have to do it daily and they have to follow up with the doctors or the physician. So it can be very challenging. So this is one of the areas that you need to work on. The silent nature of glaucoma also may prone the patients for potential difficulties with, for example, instilling eye drops, as well as the cost of the medications, which may contribute to the lack of adherence. Okay. So in glaucoma, there is narrow angle glaucoma and open angle glaucoma. So in narrow angle glaucoma, there is a severe eye pain, headache, nausea, and vomiting. There is a rapid increase in tension and edema. There is a need for early treatment to prevent blindness. This is a very, very acute condition that I would like you to keep in mind if somebody is talking about this or like they're suffering from these symptoms, that you need to assess promptly and you need to refer them to an ophthalmologist because this is one of the worst conditions that can lead to blindness. The open angle glaucoma is one of the most common forms, and it need for an early prevention to prevent blindness also. And so patients will be seeing different kind of pictures than the one they see in narrow angle glaucoma, and they will not be suffering from headache and nausea and vomiting. So it's a less acute condition. However, it's a very important condition that we need to address very early in the disease. And I can show you some pictures of how the patients will be, later in the presentation, how patients will be seeing pictures. Macular degeneration is one of the very important conditions also. It can cause blindness in adults over the age of 65, and it involves damaging or the breakdown of the macula, which is usually happening because of, again, aging and degeneration. There are some researchers that have been talking about neurological dysfunction and macular degeneration. Okay, so please review corneal ulcers on page 369. It will give you a better picture on how they're usually associated with photophobia. So photophobia is the most common symptoms when we talk about corneal ulcers. So please review that. Okay. So in a normal vision, picture number one is a patient with a normal vision. A patient with cataract, as you can see everything very hazy and not with like in depth. And then people with macular degeneration will be seeing black spots around when they see things. It depends on where is the macular degeneration happening. So it can be to the side, it can be on the center. And then patients with glaucoma, it's just so hard for them to focus and they can see half of the pictures, or they can see the contrast of the pictures much more inconsistent. Let's talk about hearing deficits. So as we mentioned, presbycusis or normal age-related changes of hearing loss. This is a high incident, and the causes is because of degeneration again in the small structures of the ear. Okay, there is inner ear problems that are caused by vascular disorders, and also recurrent viral infections. So if somebody is having a recurrent viral infection when they get older, it may affect their hearing tremendously than people who don't get these viral infections. So there is, for example, an otosclerosis. They may suffer from tinnitus, which is hearing sounds, and also a lot of infections because of the cerumen impaction. So we should encourage an audiometric testing every 2 years at least, or every year, so the problem can be detected. And if it's age related and could be treatable, or if it's sensory and we cannot treat it, then we should know by an audiometric test. So, and that's why it's very important to do it at least every year or every 2 years. So we should also instruct the patient and help them to learn to live with hearing deficits, such as, for example, by using hearing aids. And hearing aids have a lot of benefits, and but not all the older adults will be accepting it, because it may cause them headache, and it may cause them a lot of discomfort when they first start hearing voices, because they have been having a reduction in the voice or in hearing voices. Okay, so there is a huge need, of course, before going ahead and using a hearing aid, to be examined by an otologist. Again, we need to consider the financial aspect of it, because hearing aids are very expensive. Some of the institutions here, just like Al-Masara, for example, they are offering help of hearing aids with a reduced cost. What are the common nursing considerations that we need to consider when we deal with sensory deficits or an older adult that is having a sensory deficit? So number one, of course, is to promote hearing. So a good care of the ears during lifetime, and especially when they are an older adult. And then also assessment for impacted cerumen. We can take it off, there are certain instruments that can take the cerumen impaction, and also irrigation of the ears in addition to the instruments, or removal of the impaction. Okay, health education is very important, related, for example, the effect of noise and how reduction in noise can improve our hearing function. Okay, nurses need to be very skillful, for example, in physical examination and assessing the function of sensory assessment. There is an assessment guide that I would like you to go ahead and read, which is 26.1, which is on sensory function. Okay, we nurses also should be aware of the implementation or the use of assistive devices, such as hearing aids or glasses or lenses. All these we need to be educated and be able to instruct our patients on how to take care of them. And we have came to an end, and we have a practice question. Please also check the answer in week 8 folder in your model. So let me read the question. A 65-year-old woman who recently diagnosed with conjunctivitis. Now she's complaining of photophobia, but initially the symptom was not present. The nurse caring for this patient advises her to immediately see the ophthalmologist because of possible corneal ulceration, possible macular degeneration, or possible new cataract, or possible open angle glaucoma. Please think of the answer and before you go ahead and check the answers.